All right. Good morning, everyone. My name is Wana. Welcome to this. This is our first time doing a Google Hangout. We're here live at Nordica Fertility Center, and we're going to be discussing male factor infertility today. And of course, I have to introduce our esteemed guests who are here with us. We have Dr. Abayomi Ajayi, who is, of course, the MD of Nordica Fertility Center. Welcome, welcome, welcome. Let's just show you guys his beautiful face. um, Thank you so much for being here. We also have Tola with us. Tola is a fertility counselor. She's going to be answering questions around the psychological and emotional side of things. And we also have Franca here with us. Franca Owudinji is from FI, which is the Fertility Awareness Advocacy Initiative. Welcome, 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 everyone.
Thank you.
All right. So I'm going to throw a question, first of all, to Dr. Ajayi, who is going to tell us about, give us a bit of an overview on male factor infertility.
Well, thank you very much, Wana. It's also my pleasure to be part of this historic thing. Male factor infertility is said to occur when the man is responsible for infertility in the union. That is when a man is not able to impregnate a woman in spite of regular intercourse, regular unprotected intercourse. That means there is no contraception at all, and still pregnancy is not ensuing. This is a common thing. Though traditionally we thought it was not common. About 40 to 60% of infertility is due to the male factor.
Okay.
And so that's a snippet of what male factor infertility is.
All right. So I wanted to ask you, what are some of the factors involved in this male infertility problems concerning it?
Well, we can look at it from, let's say, three aspects. The first one is when there's low sperm production. The second one is when the sperm produces abnormal, either is not moving or the shape or form is abnormal, or thirdly, when there's a blockage. And this can result from illnesses, from infections, from injuries, either the man falls on a manhole or the doctor during a surgery has clipped off the duct that is supposed to transfer the sperm into the semen. So, and there are other things like environmental factors also, which is a very common thing these days, which is one thing that everybody's working on, that the environment might be contributing to male factor infertility. There was a study just last year that showed that there's some things in plastics, in pipes, in even toothpaste that might be responsible for some of these reasons why male factor infertility appears to be more common than what it was now.
All right. What about what are the common problems relating to it? So, how common is it? Because a lot of the time, when people think about infertility, especially here in Nigeria, the woman is the first, point of call. So, how common is it, and how much are we ignoring male infertility?
Well, like I said earlier on, that about 40 to 60% of infertility is due to the man. So, if you want to look at the most common cause of infertility in 2015 is probably male factor. And this has been shown in so many studies. In Denmark, they've shown that about 40% of men will probably have low sperm count. Here in Nigeria, we did a study here comparing sperm count 10 years ago to now, and we saw that there was about a decline of about 30%. So this is a common thing here. There is no doubt about that, and all over the world.
All right. So Tola, I want to ask you, with this sort of high ratio, why is it difficult for men to come and get tested or to find out? What are some of the factors that cause the fact don't help them come forward, basically?
Up till recently, men are not supposed to be infertile.
because when there is a challenge in the family, what you find out is that most times the men will not come to the hospital with the women because they are not supposed to be infertile. So, but until recently, they've been coming to the hospital, they've been tested, and of course, we know that the challenge of male infertility is high. So, there are a lot of people are coming out to get tested and to know the challenge that they have.
But are they seeking treatments?
Well, yes, like I said, the awareness is more now. So they are coming out, coming to the hospital to get tested. We have a lot of men coming out now to know that, okay, there is a challenge. What do we do about it?
All right. Um, Doctor, I wanted to ask you, what are some of the symptoms of male infertility, and how do they get tested for it as well? Are there any special or specific tests available?
Oh, well, definitely. Now, to first of all go to what are the symptoms. Unfortunately, most of the time, the commonest symptom is that the man just cannot impregnate his wife. Okay, so that takes a while for you to see that. But sometimes there are other symptoms. Either you have problems with ejaculation. Okay, either the man knows that uh, either ejaculation is premature. Okay, before the man is able to have effective penetration, he ejaculates. Or sometimes he does not even, he can't, the ejaculate is not even coming through the proper place. So those are sometimes the symptoms. Or sometimes luckily, I say luckily because this is one of the things that immediately makes people to be conscious that there's a problem. There's a swelling in the testes. Okay, sometimes this happens, and this is something that shows you that there's a problem with fertility. So most of the time there are no problems except the man cannot impregnate his wife.
And what about lifestyle? How does lifestyle affect infertility, male infertility especially? What are lifestyle factors?
That's one thing now that we're seeing, that obesity it's supposed to can contribute to male infertility. There's so many studies that have been shown that obese men tends to have less sperm count than people who have normal BMIs. And then, of course, use of some things like cigarette smoking, alcohol consumption, excessive caffeine consumption. I said excessive because I also drink coffee. But if you drink in moderation, if you drink about 3 cups a day, you're still good. But above that, then you need to start watching out. Now, the other thing, of course, a no is hard drugs. That depresses sperm count very badly. And so those are some of the things. Of course, we talk about the kind of work that you do, because we know that when the testes are exposed to very high temperature over a prolonged period of time, that might affect sperm production. So we talk about people long distance, the truck drivers, we talk about Okada drivers, we talk about people who work in some industries like paint industries and so on and so forth. So those are some of the ways that lifestyle can affect male factor infertility.
I want to harp on the lifestyle issue of obesity, and I know a lot of people are taking exercise seriously these days. You see lots of people running on the streets, walking the Lekki Bridge, and all of that. What is the mechanism of how obesity affects male infertility? Is it a hormonal thing? Maybe as the bigger you grow, certain kinds of hormone imbalance. What are the particular specifics about that?
But really now, it's not that we know precisely. This is just an observational thing. But one can explain it from first principles. We know that when you have adipose tissue, the more adipose tissue you have, the more you can produce a form of estrogen, which can have an effect on your testosterone production, and therefore can lead to derangement in sperm production. So, yeah, but it's more of an observational thing.
Okay. Tola, let's look at the psychological aspects of things. I mean, getting physically tested is one thing, but what about even the follow-up? Is there any psychological support available to men dealing with infertility issues, especially bringing it to our climate where culturally, the man is supposed to be, there's a pride in being able to have children and all of those sorts of things. Is the counseling specific? Is it different? And is there any follow-up as well? And what services are available? I know it's a lot of questions in one, but I'm sure you can answer them.
Well, like I said initially, that men are not supposed to be infertile. The feeling that
Okay.
I'm not a man, when it's been tested and it's been proven that there is a challenge in the family, and probably this challenge is due to male factor, the man will
Yeah.
lose all sense of responsibility, sense of, just, he will just lose everything. His feeling is that I'm not a man. And sometimes when the woman is very uncooperative and says it to his face that I would rather go to a real man, then that man is finished. And that's the kind of feeling that they have and carry about. And it makes them to be so nasty sometimes, and they really don't want to listen to anything. Especially maybe in the past, they've been able to impregnate a woman, and it's like, what is the problem? I don't have a problem. Maybe they need to check and all that. But when the reality sets in, that there is probably a low sperm count, very low sperm count, or maybe there's no sperm at all, that's when it's obvious that things are really out of hands. And of course, it affects every aspect of their lives. It affects their work, it affects their home. They cannot function well unless they get someone, they can talk to. And that's why we have counselors in-house where they can come in and express their mind. And we can also tell them that you are not alone. It's not a matter of, like you said, it's about 30% of the factor in infertility in the couple.
Yeah.
So it's not just something that you say it's peculiar to you alone. There are so many men in that category. So they need to have someone to talk to know that that's not the end of the world. And of course, there is a way out. There is always a way out. So once they
So,
have
Tola,
that at the back of their mind,
have they been consistent in their counseling session? Compared, I'm just looking at this compared to women in fertility. Have the men been consistent in, taking care of themselves emotionally and psychologically through this challenge, in your experience?
Not really. Women are more open to counseling than men, because especially when the counselor is a woman, it makes it a bit difficult for the men to come out. But that's the information that we are trying to pass across to them, that either you are seeing a man or a woman, you need someone to talk to. And by the time you express your feeling about the challenge that you have, and someone is able to offer some advice and way forward, then they feel better. So the people who have been coming around, they come regularly, to attend to counseling sessions, but some are still not able to do that.
All right. Dr. Ajayi, I want to know about treatment. Can you enlighten us about the treatments available? And again, the way I asked Tola about consistency, have the clients you've seen, have they been consistent in seeking treatment?
Maybe I'll take the last question first, because the treatment for infertility is usually a couple thing. So whether men like it or not, they just have to. But I must be on the men's side this time. That it's not as bad as you guys are painting it.
It's okay, you are outnumbered.
No, but seriously, I'm sure Franca will tell you that later on. It's not as bad as you're painting it. Men are beginning to understand that there's a problem and they're seeking help. And Tola can tell you that sometimes the first contact we have with some couples is even with the man. So things are changing in Nigeria as far, but let's go to the treatment. Now, the treatment, it can be drugs, but let me sound that only about 5% of male infertility we will have that drugs will be useful. As in 2015, there is still no sperm booster. There is no drug that is a sperm booster. So unfortunately, people waste so much money and time on so many drugs trying to boost their sperm. Unfortunately, it doesn't work. Now, most of the time, if you really have low sperm count, then what you probably will need is assisted conception or assisted reproductive technology. But I must tell you again about drugs. Antibiotics sometimes are prescribed not because we want to restore fertility, just but to treat infection. So if there is still an ongoing infection, that can be treated, but don't expect antibiotics to reverse your fertility. The times that drugs might be useful is if the infertility, male factor infertility, is due to erectile dysfunction, when the man can't have an erection, okay? And then therefore we can use drugs for that. And then once in a while also when there is hormonal imbalance. But like I said, the biggest chunk of treatment for male factor infertility is assisted conception, or a branch of IVF we call ICSI, or intracytoplasmic sperm injection. What this means is just that we take one sperm and inject it into one egg, okay, in the laboratory, and then when we form an embryo, we transfer back into the woman. So it's a form of in vitro IVF, and that's why I said the men don't have a choice, because the two of them have to be treated together. So even if the man does not want to do the treatment, I'm sure the woman will not allow him to rest at home. So most of the time they have to do this. But because again with advancement, because that until the first baby from IVF was in 1978. Okay. Until 1992 we could not do that ICSI that I spoke about now. But from 2001 also, we've been able to do something even better than what we call ICSI, which we now call IMSI. Okay, what all this means is that, I told you that in ICSI, you inject one single sperm into a single egg. Yeah. When we started, we could only magnify this sperm to about times 400. So we could only just differentiate the sperm that were moving from the ones that were not moving. Okay, and so we used the ones that we thought were alive to inject into the egg. But as time went on, we saw that we were getting pregnancies, but we were also getting a lot of miscarriages because we were using sperm that were not normal to fertilize eggs. And therefore, from 2001, an Israeli group started doing something where they magnify this sperm to about 6,600. So you can see all the various parts of the sperm and be able to tell whether this sperm is good or is not good. But that's just looking at the shape. That's looking at the morphology. Okay. So, and we got better pregnancies and we got less miscarriages. And all this, what I'm talking about, are present in Nigeria anyway. Okay. Now, but recently also, we saw that even we were still not getting as many live births as we wanted from the number of fertilizations that we had. And therefore, another method came up which we call PICSI, or physiological ICSI. What this means is that we have now been able to see that, what we are trying to copy is nature. All right? We've been able to see that in nature, the egg has a particular hormone that attracts normal sperm. So in nature, there is natural selection. Okay? So this hormone has now been, or this protein has now been identified, this enzyme has been identified, and now we put it in a dish and we put the sperm sample there. And it's only the sperm samples that are able to attach to this dish that we now use for ICSI. So that's why we call it physiological ICSI. And that is also helping us to get a lot of pregnancies and reducing the time that we use to pick these sperm cells. So, but also, there is another thing now that we also probably, as we get there, we've also seen from treating men that sometimes you see the sperm parameters appear to be normal. But when you do ICSI for these patients, they don't fertilize their eggs. And so now also there's another thing that we call DNA fragmentation, that we look for. Because we know the only thing that the sperm does is to fertilize the egg. And what the sperm is doing is to transfer the DNA to the egg, which forms an embryo. If this DNA is already compromised, then the embryo is of bad quality, or which might not, there be no pregnancy, or there might be miscarriage. So now we are also able to test for DNA fragmentation. even what appears to be healthy sperm. I think we'll talk later about DNA fragmentation in this discussion.
I wanted us to follow up on DNA fragmentation and what are some of the causes of that.
Okay. Now, one thing is that sometimes it's as a result of age. Okay, so as a man gets older, the more the fragmentation of his DNA. But some illnesses also, especially febrile illnesses, fevers, can cause DNA fragmentation, and anything that increases the temperature of the scrotum. And that's why we're saying that, and the testes, that's why we're saying that men should not put their laptops on their laps, okay? Because that will increase the temperature around there. That's why we also talked about people, long distance truck drivers and Okada riders as possible causes of infertility, because there can be DNA damage. Then there is something called varicocele, which also we know has been linked with infertility. But for a very long time, we could not explain why this might be so. But we now know that there is preponderance of fragmented DNA in the sperm of men who have varicocele. So these are some of the things that can lead to DNA fragmentation.
All right. We have a question here. We have a question here from Samuel Sumi, who we're going to read. It says, "My question is for Dr. Abayomi. There are believers that and opinions that high sugar consumption, such as soft drinks and sweetened food, affects sperm performance. How true is this?"
Well, not totally true. But you know that if you drink soft drinks for a very long while, you start putting on weight, and the obesity complex can come in. But also, because there's a part of the body that is supposed to break down sugar, which is called the pancreas. If it's not working well and you have diabetes, this also, I said some illnesses might disturb sperm production. If diabetes is not well controlled, also could lead to what we're talking about. But not that because you're taking sugar, then your sperm count should be low. No.
Okay, we also have another question here from Chukwudieze, who says, "I've often heard that drinking herbal alcoholic drinks like agbo can boost sperm count and make a man fertile. How true is this?"
I don't think it's very true. I don't think it's very true.
But a lot of speaking about that, there's a lot of, when it comes to herbal remedies, people are propagating all sorts out there. And I know that you did say there are no sperm boosters yet.
Yes.
So, but a lot of people are combining so much. I want to even know, is this toxic to the system in any way?
Well, unfortunately, sometimes that's what this might do. Okay, I share an experience with you. This is not even herbal concoction. A gentleman, I saw a gentleman many years ago who had a growth in his testes, and the story was that when we took the story was that the man, his friend, they had the same issue, low sperm count, and the friend went to see a doctor who placed the friend on some drugs, and he said there was an improvement, and this gentleman took this drug and started using the drug. Well, not even finding out how long the doctor prescribed this drug for his friend. He had been on the drug for about 9 months. Now, this is a drug that when they prescribe, you don't even take it more than 1 week, 2 weeks. He had been on it for 9 months. Now, I don't know whether that is the cause of the tumor that he now has in his testes, but they can be linked. And so sometimes that's what we do to ourselves. Self-prescription, we have always said, whether with herbs, with anything, I don't think is on.
I want to ask you about food and diets. We eat every day and we live off food. Are there any chemical components in certain kinds of food that may influence or affect male infertility, male fertility?
Well, if you don't get fat, okay, if you don't become obese, it might not be deleterious. But people are even talking about food supplement as a treatment for male factor infertility. They're looking at trace elements, but unfortunately, these are not proven yet. It's a big industry. Even talking about, there's so many food supplements that people are talking about to help to cure male factor infertility. Unfortunately, the evidences are very vague. You know, in this world we live now, we say medicine must be evidence-based. So right now the evidences are very, very weak, but I know they exist out there.
Yes, I can. Sorry. I really can't pick the question very well. Okay, can you come? No, I really can't hear you. I can't hear.
I think it's from Wana's end.
Yeah. Hello, Wana, can you hear me? No, I think we cannot hear you again.
Anyway, maybe why they're trying to fix Wana's end.
Okay, we're
Wana
back.
is back. Wana is
back. I'm back. All right. Okay, we just lost connection for a second there, and yes, we are live here at the male fertility chat, Google chat, and of course we're here at Nordica Fertility Center. Dr. Ajayi is here. We have Tola here with us. We also have Franca here from FI. And just before we went off for a second, I was asking Tola, I said, is there any connection between the emotional state of mind of the man and exacerbating their situation? As a lot of the time, we always say that, we are connected, body, mind, and spirit. And if we're not in a good place emotionally or spiritually, or just our mental state of mind is not in a good place, then, it affects other situations that we have going on as well. So is there any connection? That's what I want to know.
Well, that's not going to affect your sperm count, but it can affect your erection.
Okay.
So there can be some erectile problems with that. So, but not about sperm count. But of course, low sperm count can also bring some emotional problems.
Okay.
I hope you understand what I'm putting across.
Absolutely. So it can affect your ejaculation but not the sperm count itself.
Not the sperm count.
So not the sperm count. Psychological impacts of male fertility. What are the psychological impacts of this situation?
Okay, for instance, if in a home, in a particular home, there's a challenge with the sperm, and sometimes it makes the man to want to try himself outside. He wants to have sex outside the marriage to prove that he's a man. And we have seen in a lot of times that a man will come back home to tell the wife that someone is pregnant for me. And of course, that affects the home, a lot. And the wife is going to be like, okay, the doctor said you have issues with your sperm. How will someone now say she's pregnant for you when I've been satisfied? Okay. Then sometimes I see a case like that, the lady requested for a DNA, and it turned out that the man was not responsible for the pregnancy. So sometimes this brings a lot of troubles in the home, because if the woman, if she had accepted that the child belongs to the husband, then it would have been like, oh, you are the one with the problem, not the man. But she insisted on a DNA, and the DNA said the man wasn't responsible for the pregnancy. And that's why we see sometimes when there is a challenge in the home and the man goes outside, most of the time they bring children from outside that are not there into the family, because they are unable to accept that they have a challenge. They want to prove that everything is okay with them, so they have a girlfriend outside who is going to bring another child from another man. So it brings a lot of challenges to the home, and if care is not taken, the home can break. You know, a lot of things will happen in between them that they will not be able to come to terms with unless they address it quickly. And that's why we'll let people know that IVF is an option that they need to really explore, instead of having the home to break.
We have lost Wana again.
Wana?
Well, while we're waiting for her, I think, yeah, to buttress what you've been saying, I mean, this psychological aspect of infertility, mentioned about seeking professional counseling, but can we also look at, is there any impact for a support group? Can a support group be of any help here?
Yes, it loves, because when people come together, I think it will help. Support group in this part of the world, in our own society, is not common. But that's one thing that we are trying to put across to people. People need to come together to share their experiences. It helps a lot. The women have started that. We have some men too coming to the group, which I think Franca is going to talk about, and I think it's helping.
Wana is back, so I'll give her to continue. But I think it's a good point to bring in Franca.
Franca, absolutely. And Franca, let's talk about Fertility Awareness Advocacy Initiative. What do you guys do, and how have you been involved in male factor infertility and just creating more awareness about it?
I would start by saying the meaning of FILE, what we stand for. FILE signifies Fertility Awareness Advocate Initiative. And is a group of persons or a group of couples that have a success story. What does this mean? We have a success story, we have IVF treatment, and it was successful. And we decided to come together to give our story, to give our testimony, and to encourage others that are infertile or that wants to come up with this treatment, but maybe they are scared because of one thing or the other, because of one reason or the other, they are scared. So we encourage them with our testimonies, with our experiences, and if need be, we make arrangements to support them financially. And I want to say this, we also counsel and encourage them. We do this every last Sunday of the month here in Nordica Fertility Center.
How important and valuable has it been that there's an open space for people to share their stories? Because I know that a lot of people sometimes they feel very alone when they're going through this. So how important has it been for you to have people who are really sharing their stories honestly about what they're going through?
Actually, it has really impacted on so many couples. For instance, when we stand out to give our stories and testimonies with references maybe bringing our kids, our triplets, our twins here to show as evidence that they don't come out from the sky, they didn't fall from the sky, that the procedure is true. And for people that are lucky, it's success. They have success story to tell. So it goes a long way to encourage some of these couple and some of these families that wants to go into IVF treatment.
Okay, Dr. Ajayi. So, doctor, let's talk about indications for male patients who may benefit from tests that are available to them. What are the indications?
Are we talking about male factor infertility generally,
yes,
or are we
factor,
talking about DNA fragmentation?
Male factor. And DNA fragmentation, both.
Oh, okay. Because they're a little bit different. For male factor, what we recommend is that if your wife is below 35, if you are not able to conceive after 6 months of 1 year of unprotected sexual intercourse, you should see a doctor. If your wife is above 35, then you wait for only 6 months and see a doctor. But for DNA fragmentation, it's a little bit different, because sometimes in DNA fragmentation, the sperm count appears to be normal. And so when you have unexplained infertility, it's a reason to do DNA fragmentation testing. And that is available, like I said, is available even in all this, what we're talking about all day is available in Nigeria. Now, when you have done IVF and, for example, you have poor embryo development, then it's an indication for you to do DNA fragmentation testing. If you have, for example, poor blastocyst development during your IVF, then you should do DNA fragmentation testing. If you had repeated failures from ICSI, you should do DNA fragmentation testing. If the man is advanced in age, you should do DNA fragmentation testing. If you have varicoses, you should do DNA fragmentation testing. And also, if you are obese, and then you probably need to do DNA fragmentation testing. So these are some of the risk factors that once we have those risk factors, then we want to look at whether we're missing out on something. Because like I said, majority of these people, their sperm appear to be normal.
Okay. What is Nordica doing to increase awareness about male factor fertility issues, and then especially DNA factor fragmentation as well, the testing?
Well, the best we can just do is to continue to talk to people, engage people at various levels. Okay. Fortunately, FI brought this kind of opportunity our way also to be able to talk about this very important topic to the populace. But some of the things is that we're like trying to create a new pathway. The old beliefs are here, but we're not discouraged about that now, because when we started even the IVF journey about 12.5 years ago, the level of awareness is not the same as it is now. So we believe that with persistence, we'll be able to get people to be up to speed on what everybody knows about male factor infertility. Because there are some countries, like I'll continue to cite a country like Denmark, that the awareness of male factor infertility is so high, and people know that it's real, and they're doing something about it. Oh, Wana, I saw just a question now, and I want us to talk about it. Have you seen it? My question to Dr. Ajayi: effect of staphylococcus on sperm, please. Unfortunately, that's one thing that it's ascribed into Nigeria. I think it's only in Nigeria that we have this staphylococcus industry, where people talk about staphylococcus as a cause of low sperm count. It's not true. It's not a true thing. Now we've been saying this for quite a while, but I think that's one of the things I'm saying, that the level of our awareness is so low that so many people have taken advantage of us. And but Staphylococcus, I know, is a big establishment in Nigeria, but unfortunately, it's not scientific.
Oh dear. All right. Tola, let's talk about coping mechanisms. What kind of coping mechanisms do you teach during your counseling sessions as well for men with male factor infertility?
Well, as we all know that men, when it comes to challenges of infertility, they are more stronger than women, because the effect of infertility on the women is more seen than the men, because it's the woman that you are looking out for pregnancies. She's the one who sees a period every month. But the men, they tend to internalize the challenges, the troubles that they have. And most of the time, some of them take it out on their women, and they burst out in anger, sometimes by beating them, and sometimes just getting, out of control. And like we said, counseling is still the best thing, because when you have a challenge and you have someone that you can share your problems with, I think half of the problem is solved, because you'll be able to cope better. You know that you are not alone in this situation, and you know what to do. There is no, how do I put it? You cannot run away from the problem. You just have to face it. And if you sincerely know that you want a child, then IVF is the option that you need to consider. So going from one doctor to the other, treating staphylococcus, treating whatever problem that is not there, or that you are not trying to get a solution to, will not be an answer to the problem. The answer to the problem is to face the issue. I have this challenge of male factor. I need to seek help, and my fertility doctor has said that we need IVF. Then you just go for that.
What is the rate of Tola, what is the rate of people coming to terms with the condition? Because I can imagine that denial is also a factor sometimes in this. So what's the rate of it from a lot of the patients that you've seen and clients you've seen? What's the rate of progress in terms of coming to terms with the condition, so that they can actually get treatment and move on to having wonderful families?
Well, in the clinic now, by the time they come to an IVF center, really, I think they've been able to come to terms with it that there is a problem. Okay. If they are able to come to an IVF center, they've been able to come to terms that there is a problem, and they seek solution. But when we talk about male factor, don't forget that doctor mentioned that we have them in categories. If you have a severe oligospermia, that is a low sperm count, it's different from no sperm at all. So when you have low sperm count, your challenges will be different from someone without sperm cells, So the way you are going to handle them will differ. The person with no sperm at all, of course, you are going to handle him more, because the effect is more on him than someone with a low sperm count. Because what you are saying, in essence, what the man is going to take home from that is that I cannot father a child.
Okay.
But that's not true, we know. We know that that's not true, because we have some procedures that we do, especially for those who have sperm cells, but they are not coming out, as in maybe because there's a blockage somewhere. We can go through the testes and bring out semen. And we've had a lot of success stories from that also. So sometimes they're in denial. This cannot be happening to me. I've been able to impregnate a woman in the past, and this is not happening to me. But when the reality sets in that this is your situation, then I think the percentage of people we have now is high who come to terms with the situation and they face the challenge.
All right, that's great. We have some questions in our group chat. Someone here says, my question to Sutolu is, how do you usually handle a situation where the man is over 60 and the wife over 45 and still wants to have children? So Tolu, this is for you.
Tola. Well,
I'm so sorry.
For the fact that the man is over 60 does not mean that his sperm is low. There may be some challenges in the functionality of the sperm. which of course we have some treatments for. That's why we have MC. That's why we have MC. That's why we have FIXI that doctor mentioned earlier on. So, seeing both of them, the man is 60, the woman is over 45, is for them to make the right choice of treatment that is available to them. Because sometimes when we offer them, this is a type of treatment that is suitable for you, some people will still say, no, I don't want that type of treatment. For instance, if you are talking about donor eggs, some people still want to go ahead with their own egg, but we know that the chances are quite low. So it depends on their choices that they are taking at that moment. But for the fact that a man is 60 does not make him to be to have a low sperm count or to have a male challenge, unless maybe there is a problem with his erection.
I think Wana seems to be having some challenges with Franca, can you hear me?
Yes, very well.
Okay, because we didn't introduce you properly. Is Julian somewhere there?
Yes, he's with Wale.
Okay, now Franca happens to be the mother of Nordica's first baby, who just graduated from from primary school and is going to secondary school.
Wana is off. She's not hearing us.
Yeah, well, I think we just go on while they're trying to fix Wana's issue.
Nobody is assisting her. Wana is off.
So maybe if you can bring Julian also so that they can see him. He should just make a showing. I know he will want to talk, but he should just make a showing. Just take a bow. Why is they're fixing Wana? Yeah.
Okay. Julian is here now.
Here comes Liam, but I can't see his face. Okay.
Yeah,
yes, that's Julian. Yeah, so that's Julian. That's Nordica's first baby, and like I said, just graduated from primary school. Okay, Wana is back. Okay,
I'm back. Apologies again. I'm back. We're stronger and better. All right. We talked about staphylococcus. Tola mentioned it. Doctor also mentioned it. I mean, what effects of staphylococcus and any other STIs as well on or even pre-existing conditions on male factor infertility? I would like you to elaborate on that.
You know, I said earlier on that when I was taking treatment that drugs, antibiotics cannot reverse fertility.
Yes,
it's like bolting trying to bolt the how do you call it, the stable after the horse has gone. So it doesn't make any sense. But if you have an ongoing infection, it should be treated. Staphylococcus, there are different kinds of staphylococcus, but the staphylococcus that people are even talking about most of the time is just a contaminant, okay, which lives on the skin normally. So if you continue to treat it 10 times, you will still continue to get that staphylococcus because you are trying to get it away from where it lives normally. It's not going to cooperate with you. So that's why we said, come on, this is not, if you're talking about chlamydia infection, yes, we know that can affect your fertility. You know, if you're talking about gonococcus, yes, that can affect fertility. But the other things, they just, most of the time, they're just incidental findings. And that's why what we're doing in Nigeria is like majoring in minor, looking at things that don't exist and building an industry around it. So it's a no when it comes to male factor infertility.
Come closer.
Okay, can injury to the testes of a child when he's young affect the fertility when he grows up?
Oh, sure. Sure. We talk about injuries that if it leads to blockage, okay?
Yes.
The tube that transfers sperm from where it is produced to where it is needed is a very fine tube. So if a man falls on, for example, either where he's playing football is kicked around the testes and there is bleeding, and then it absorbs with the inflammation, then you could have some problem with the tube. Or if you have you have a surgery, especially hernias, when you do hernia repair and the doctor does not know enough, especially when it's done in the interland, and the doctor cannot differentiate between doing when it's like getting the sac, take out that fine tube away from it, it can cut it, and that can also lead to male factor infertility. But the good thing to us about when that happens is that most of the time the sperm is still producing, the testis is still producing sperm. And so when they come to us, it's easy for us to get sperm from their testes and use it to fertilize the wife's eggs.
I remember also hearing about goiter. People, young men who've had goiter when they were much younger. How does that affect or mumps? Sorry, I think it's mumps.
Yes,
I remember hearing
it's
about.
mumps.
Yes, mumps. Yes.
Good. I was
Sorry
afraid
about
when you said goiter.
No, mumps. How does mumps affect? Because I've had young people having mumps as children, and then it affects their male fertility as adults. How does that work? What's the mechanism?
Okay, when you have mumps, especially in your teenage years, it's been seen that in about 40% of the time, your testes are also affected. So you have what we call mumpsitis. Okay, and when that happens, it can lead to shrinking of the testes, and the sperm count might just be affected in future. So that's been shown also that when you have mumps as a teenager, it's very important that we check out for orchitis at the same time, or that's the inflammation of the testes.
Okay. We have someone here in our group chat who says, I know this says, please, doctor, please, does IVF treatment determine sex of babies? I know has not very much what we're talking about, but go ahead.
But yes, it can. But I must warn, it's a different thing entirely. It's not the part of routine IVF. So if you want to do that, it's called sex selection, and that's like it's like we see IVF like in a car, okay, functional car, like what will I say now, like a Toyota car. But by the time you're talking about sex selection, you're talking about buying the top of the range. I don't know what your taste is. maybe it's a Jaguar or whatever. So it's a premium. It's a premium. So that's what I'm trying to say. But it is very, very, very possible to do sex selection during IVF. And we do that.
Franca, all right, fantastic stuff. Franca, you talked about your FIVE being also that's Fertility Awareness Advocates Initiative, also being a support group, and you say you meet once a month. Are you getting, is there traction in terms of the amount of people that need support and that come to support groups? Because sometimes support groups, a lot of people they're always worried about and don't know how to express themselves with other people. We're very private people, so we deal with our problems ourselves. Again, going back to our Nigerian culture. So is there any traction? Are your members increasing? Are your group members increasing? Are they open about sharing as well?
Yes, they are really increasing. The last time we had meeting here, we were over 40 because it was advertised on the paper. So a lot of people turned up, and we share our experiences, we share our testimonies openly. We don't hide about it. We don't hide about the fact that we got our babies from IVF, because actually these babies are normal babies. Like you've seen my child, he's a normal child.
Absolutely.
He's graduating as at the time other kids of his mates are graduating. He worked as at the time he was supposed to work. So what is there to hide?
Oh, we're actually almost running out of time. I just want before we run out, I'd like Dr. Ajayi to really talk about Nordica and what you've been doing and the help and treatment available to people, all kinds of people, but mostly on what we're talking about today, which is male factor infertility. What kind of treatment is available to them? Why do people need to actually come and visit Nordica? Even if they just have, I'm sure people have questions to ask. You are available to answer their questions as well.
Well, yes, because the one of the things that we've seen as the problem with the IVF service in Nigeria is education, and therefore we have this. It's free. You can walk in at any time to ask questions about IVF. Okay, but Nordica is an IVF clinic, and what we boast of the quality of service of what you can get anywhere in the world, and we have so many strategic alliances with. The name Nordica suggests that our headquarters is in Denmark, but apart from that, we also have strategic alliances with the leading IVF clinics all over the world. For example, there is a clinic in Spain called EV that does one of the highest number of cycles in the world per annum, and we are always in contact with them. We do a lot of things with them, and so we're an IVF clinic. But we also have seen that the psychological impact of infertility in Nigeria is not, people are not really facing it so much. And therefore we have trained people as counselors to be able to give succor to people who are facing this challenge, to help them face this challenge, because we are aware that is one of the most challenging things that couples can face. We also have things like acupuncture services in order to take it, because we know that stress and infertility tend to go hand in hand, and therefore anything that will distress you, we try to put in place, especially when you're going through your IVF treatment, because we know that infertility leads to stress. The treatment itself also leads to stress, because people are anxious about what will the outcome be and so on and so forth. Also, they still have some underlying problems from that they have been handling before. So we try to help them to be able to do all this, and so that's what Nordica does in the Jiffy.
All right, thank you so much, Tola. I just want you to round off on how important and vital psychological and emotional support is to anyone going through.
I will want to say that to encourage the men to come out as they've been doing, we want them to come out more, and we want them to talk about the challenges they have. Let us be able to help you to overcome these challenges, in not just in having children, but in having a stable home, because that is also important to us. Very, very important. So when they come, we talk to them, we advise them, we counsel them on the type of treatment that is available to them, and we also want them to have a peaceful home, enjoy their marriage.
All right, fantastic. Let's go to Franca finally from FI. Franca, how important is it that people actually give I don't want to say give a testimony about their success, but how important is that they can share their stories are going to help other people? How vital is it that people need to be aware of that? How important their stories, and in just even humanizing and personalizing the situation as well?
It's very, very, very important that you share your story, you share your testimony, so that other people can benefit from that. Like my own, I tried my IVF by the story I got on the internet. If I didn't get that story from a couple, I wouldn't come to try the IVF. And I was lucky it worked out for me. So I will keep sharing the story. So I encourage other couples, other families to come out and share the story. Please. Thank you so much.
All right. I would like to say a massive thank you for all of you who joined us this morning. Even through all our technical challenges, we really appreciate you staying with us. It's very, very vital and important conversation as well. Big, massive thank you to Nordica Fertility Center for hosting this. I think it's an incredible and laudable effort to educate people, young and old, about male factor infertility. Dr. Ajayi, Dr. Abayomi Ajayi, who is of course the MD, thank you so much. Tola Ajayi, thank you so much, our fertility counselor, and of course Franca from Fertility Awareness Advocates Initiative. Thank you so much as well for coming through. Just to every single one of you out there, please make sure that you educate people, let them know, inform them that, look, there is help available. There is help available. Sometimes as little as walking through a door and just asking a question. And Nordica is always here at your service for any questions, emotional, psychological, physiological, that you need answered about as well. You can always visit their website, www.nordicalagos.org. That's nordicalagos.org. My name is Wana. I thank you all so much for joining us, and I really, really feel honored to be a part of this experience. You all have a
Thank you.
Thank you.
Thank you.
Offline now. Offline.
Okay.
No.